have a 22-year-old patient. His name is Aaron. He's arrived via ambulance to our hospital, to this bay, and he's been in a plane crash. He was found under a part of a wrecked plane, and when you come in, he is complaining of shortness of breath. He's got right-sided rib pain, and he's got abdominal pain. And you want to start with your assessment following your ABC process. Okay?
So go ahead and get started?
Yeah, you start.
All right.
You just follow your process.
Hey there. Can you tell me where it's hurting? Aaron? Your stomach's hurting?
Yeah.
Okay. I'm going to listen to you real quick. I guess we need to get an ABG drawn because he's having shortness of breath.
Yeah, I'll put him on some
You follow your ABC. So what are you going to assess with the airway?
Is the airway open?
You look in the airway, and he has vomit in his mouth.
Okay, I'm gonna suction the airway using knockout.
Okay?
And what about breathing?
Okay, we'll go ahead and want y'all to do everything you
Okay.
say. So we've got the suction
Can you open
there.
your mouth for me? Okay.
And you see vomit in there.
Okay, suctioning.
Okay? That clears the airway. Now, your next, Mandy, what is your next?
Breathing.
Okay, you're checking your assessment. Go ahead and look at your process.
He's breathing. He's got spontaneous breathing. His chest is rising and falling.
Okay, what you find when you assess his breathing, he's only breathing at a rate of 6. It's labored and it's irregular.
Okay. So he's going into
His
distress.
color is not good.
So
It's dusky, and he's
we need to set up for intubation.
For intubation?
Well, give me the non-rebreather and then we'll set up for intubation.
Okay. Not a breather.
And I'll let you be doing
We're
the
in this,
assessments on his airway and stuff.
That's fine. Anything else you want to check with breathing at this point?
O2 sat.
Okay, we can hook that up. We have a 2-sat monitor.
This one for you.
He's got an open wound.
Yeah, y'all want to get your gloves on. We do have gloves. There we go on the table. Okay. So you got the O2-sat monitor on. It's only reading 78%. His respirations are still very, very shallow. And he almost appears to not to be breathing real well on his own.
And that's turned up to 15 liters non-rebreather.
And he's not really breathing well on
He's
his
not
own.
breathing, so we need to set up for intubation.
Okay. So what?
But
Justin is going to intubate. So they actually want you to intubate at this scenario.
and he was an adult male, I'd probably use, I'd say a size 3 tube sufficient.
We may not have the proper size. And what do you guys want to do to the airway while he's, what would you want to do, Mandy? Anything else with the airway? The non-rebreather's not doing much.
Not turned on.
Even if it's turned on, it's not helping him. So what should we do if the oxygen is not helping him?
Bag him.
Okay, so y'all go ahead and do that. Y'all do that with the mannequin. And you
You
want
want
to
us to
show,
bag the mannequin?
yeah, you want to show Jaden
Okay.
how to do that while he's getting his stuff ready.
Everything should be hooked up to the O2, I don't know what it's called, valve. And then bagging wise, you want to make sure that this is placed directly over the nose and that there's a good suction. And then you're going to bag breaths and you're going to look for chest rise and fall. And you're going to bag one breath every 1 minute, I think.
They got one breath. How many times a minute should they be breathing?
Oh, yeah. So one breath about every couple seconds because you want about 12 to 20 breaths per minute.
Yeah, so about one every 5 to 6 seconds.
Yeah. And then you will,
So you can go ahead and you'll bag him
until he's ready to intubate. Okay.
So-
And then you want to make sure he's oxygenated, and on intubation, only give them about 30 seconds to intubate. If they don't get it in, they need to pull out so we can rebag.
Okay.
And you want to watch the monitor and make sure the O2 sats are decent.
And for an adult male, I would ideally use a size 3 laryngoscope blade. I would make sure the blade is working sufficiently, good battery, good light. And I would probably use a size 8 to about maybe an 8.5 endotracheal tube. And I have my syringe on my equipment ready. And as I intubate, since I'm using a Macintosh blade, I would go into the vernacular space and indirectly look at the glottis using my left hand. And as I insert as I visualize the vocal cords, I would answer with microwave pressure to help close the esophagus, and to better visualize the vocal cords, I would insert in the trachea tube, inflate the balloon, and then I would check for equal intensity breath sounds on both sides of the lungs.
Okay. Now, your patient appears pretty restless while you guys are trying to intubate.
Okay.
What could you do if he's fidgety?
I can give him some medication if necessary. I can push like 2 milligrams of Ativan to relax.
Okay. All right, so we've done that, and you're preparing to intubate, okay? So whenever you're ready.
And he's on C-spine precautions, so we are going to do the modified jaw thrust to open him up for intubation.
This is really too large,
So we're ready.
but I'm ready.
And then if you want to come over and apply cricoid pressure, right here. And that helps the respiratory therapist visualize it a little bit better.
Can you hold this? There we go.
Sorry. Here we go.
Okay, what are we assessing for?
We're going to listen for bilateral breath sounds to make sure that he hasn't intubated into the stomach.
Okay, you hear good breath sounds on the left, you hear diminished breath sounds on the right, and there's not good chest movement on the right.
So he has an abdominal blunt trauma, so there's potential that he has a pneumothorax going on.
You also notice that he does have tracheal deviation to the left.
So we're thinking tension pneumothorax because of the deviated trach. So,
For emergency pneumothorax, I'm going to do needle decompression.
Okay, you guys want to do that? Or we do have chest tubes available, or you can do the needle decompression if you want.
Well, the needle decompression is just a Band-Aid on the problem. A chest tube will maintain the more long-term.
Okay, and where are you going to do the needle decompression on the right side?
On the right side, you would do it between the third and fourth intercostal rib, and you would do it above the rib, because underneath the rib you have your thoracic arteries and your thoracic nerves.
Okay. All right, so we have done that. You have performed your needle decompression, and you do have a chest tube. So while you're preparing to put them on the ventilator, we're going to have Mandy go ahead and get the chest tube
You want to take your chest tube in?
ready. Sure. And if you want to help him while he gets, you want to secure the tube and,
Okay.
well, let me,
Hold this. Just
and then get the ventilator, okay. So we're going to pretend like we're putting it in where we put the needle in.
the chest.
Yeah, that goes to him, so we're going to go what's on the right side here. So, like it's here, but we inserted it.
We're just going to pretend it's correct.
Yeah. Get up under it. Can we put a chest tube in?
Come on now.
Or we're just, you need look. Okay, all right, so we got the chest tube. Okay, so we've got step that, no, we don't worry about that.
Okay, we're not gonna worry about that.
Transfusion. So we're feeling we got our suction tubing here. That would go. Yeah, and then we would set it at, what about, 20. We dial, this is the dry, so we dial it, put this up just to where we see this. I don't think it's gonna actually
Bubble,
work though.
It's the suction's not even set up in the room.
Yeah, so, to show me what else you need to do when you're setting up your chest tube.
You need to secure it to his body with tape and all that, and make
Mhm.
sure that there's a good seal.
Yep.
And then you need to check and see the water here, if it's bubbling, because if it is, then you probably have an air leak. And then make sure that you've got suction.
Yeah, and you know, you got suction, if you see the bellow in the window, and you've got it dialed to the proper. Another thing you have to do is put the water in the water seal when you set up the new, your water's back here, but we couldn't figure out how to put it in there, so we're just gonna skip that. We'll have to ask Susan on that. Okay, so we got the chest tube, in.
I can have a free hand if you need it. Okay?
All right, and
Chest
then
tube's
we've
in
got-
and it's pulling.
Yep, it's suctioning and really no drainage is coming out, you gotta get
Come on.
seal. Okay.
And so do we have it here?
He's got the airway secured now that you
Okay.
reassessed, you hear good breath sounds on the right as well as the left.
Okay.
His oxygen saturation has come up to 95%, 98% from the 78%.
Okay. Do you need some up? No, you're fine.
Okay.
So if you want to go ahead and set the vent settings and get him on the ventilator.
And what is the height of our patient?
Oh, 6'2".
6'2"?
Okay, for 6'2",
I'll probably say I'm about 700 title line.
Okay.
that's pretty appropriate for now.
And how do you determine that based on just height and?
It's actually 106 plus 6 times, in this case, 12 times 6.
So there's a formula for it?
Yeah, there's
Okay.
time for it.
Sure.
6, 72.
Are you okay bagging?
Yeah.
Okay.
And unfortunately, we, you know, in real situations, people would be doing other things, we're just following
Okay.
through that.
Okay.
Just, you gotta do the A and take care of the B before we go to the C when.
That's good.
Actually, I'd say about 800 title volume.
Okay.
A little larger. 800 title volume, a rate of 12 to 20, keep 5, FiO2 of 100 because he's in respiratory distress. And let's do volume controlled AC mode.
Okay. All right, so I'll let you go ahead and, since you're the respiratory therapist, we'll let you hook it up and get the
You
patient.
can tell me what you need to look at. This is an ancient.
Yes, I like the 0-300s and serial eyes. Here we go.